Good morning. I'm Len Fasano, Minority Leader of the Senate Republicans, and thank you all for coming here today. What brings us here today is the $103 million cut the governor put forth in his rescissions on last Friday. And in particular, the $63.4 million cut that adversely affects our hospitals across the state. Just less than 3 months into a new 2-year budget, it is already out of balance and showing a deficiency. It doesn't bode well, not only for the rest of this fiscal year, but in fact for the next 2 years. We're going to discuss this matter. We have some folks from the hospital, CEOs from the various hospitals, but to more fully understand the details of this and the impact among the hospitals, I would ask Jennifer Jackson, President and CEO of the Connecticut Hospital Association, to please address the folks in this room. Jennifer.
Thank you very much, Senator, Representative, and all of the legislators here today. We thank them for their leadership, and we thank all of the legislators who support hospitals in their community for their attention to this critical issue. As the Senator talked about, we recently announced an additional $200 million in cuts. But the number that was announced was $63 million. In reality, those cuts also caused the state of Connecticut to forego an additional $130 million in desperately needed federal revenue for this state. The reason that we are very grateful to participate in this conversation and that we very much want everyone in the public to realize is this is a crisis situation. This is a crisis certainly for hospitals, absolutely an unsustainable situation where we now have $500 million being taken away from caring for patients. But it's also a crisis situation for everyone in Connecticut. If you or anyone you love needs hospital services or anticipates ever needing hospital services, and I think all of us do, if you know or you care for anyone who works in a hospital, or if simply you just care about this state's economy and the direction in which we are heading, this is of vital importance to you. We are asking the legislators to intervene and to reverse these cuts, to make sure that hospitals have the resources that they need to care for our most vulnerable. 1 in 5 citizens in the state of Connecticut are Medicaid patients, and these are vital resources that are desperately needed to provide them the safe, high-quality care, both in the hospital and out in their community, that they deserve and to which we are deeply committed. Thank you.
Thank you, Jennifer. And we stand here oftentimes and talk about what we're fighting for, fighting against, supporting, not supporting in this building. But to have these, the Connecticut Hospital Association and these wonderful hospital CEOs here expressing how they feel, and more importantly, how it affects them, because they do this job every day. They run their hospitals, they deal with their docs, they deal with the patients, they know what the needs of their communities are, and cumulatively, those are the needs of the state of Connecticut. And when we sit there and we make cuts of $63 million to hospitals, which is bad enough, that's bad enough, but what the result is threefold, when it's almost $200 million with federal reimbursement. That doesn't seem like a good fiscal decision to me. So Senator and I are here, and on behalf of our caucuses, to ask for a special session. Either the governor call us in, or we call ourselves in, to sit down and figure out what's going on here. This isn't about, we don't like these cuts are better. That's not what this is about. This is about the process of budgeting in the state of Connecticut, and how doing it in a patchwork way, almost month to month, based on a deficit that continues to come, is not an effective or an efficient way of doing it. So we are asking the governor, and we are asking the House and Senate, one of us, to call ourselves into session, and we will stand behind that decision.
I'm going to ask Jennifer just to introduce the CEOs that are present here today. Jennifer.
Thank you. I appreciate the opportunity to introduce these wonderful individuals who so deeply care about and are committed to their communities. Behind me is Pat Charmel, who is CEO of Griffin Hospital. Next to him is Dr. John Murphy, who is CEO of Western Connecticut Health Network. Bob Smanik, who is CEO of Day Kimball. Vin Capice, who is CEO of Middlesex Hospital. Dr. Stuart Marcus, who is CEO of St. Vincent's Hospital. And Vin Petrini, who is Senior Vice President of Yale New Haven Health System.
Thank you. Sort of short and sweet and to the point, asking for the special session to restart this budget, and we're open to questions.
What sort of broad
Paul?
changes are you looking to make to this budget?
Well, here's the issue. We believe that whatever assumptions that were taken into account when this budget was done is an irrelevancy. Obviously, the economic times have changed. And what we saw last session was 4 times the governor used his rescission authority to change the budget. All of it, or most of it, hurt those who needed the services more than anybody in the state. Now, if we're just 3 months into this budget and already we have a problem, we shouldn't solve it, as Representative Clarida said accurately, by patchwork. We should be doing it by saying we're only 3 months into this budget. Let's sit down and get it right. Let's get the new data if that's what it takes. Let's get the new projections, and let's do what's right. This isn't a Republican, Democrat. It's, look, let's get together and just relook at this if the numbers are wrong, and they seem to be wrong. And I think whether you blame it on the stock market, which may or may not be the case, or you blame it on economic models that they use, which are no longer in tune with today, I don't care what it is. But what I do care about is obviously we're running into a problem, because even if you fix this, $103 million, we're only $600,000 over water, or above water, which can go in a minute, and we all know it is. So let's get it right. Let's just get in a room and rethink this thing together.
But what are we talking about? Because I don't think you're talking about tax increases. So, I mean, when you're talking about broad changes to this budget, what are you talking? Rolling back some of the tax changes that were made, reducing spending? I mean, what sorts of things do you believe need to be done?
I think there's a holistic approach that needs to be done as a group to sit and talk about it. You can't point to just one item here, one item there. This is a holistic approach to the budget that we need to do, that we've been asking for since last year with the other budget. We think now's the time we should do it, at least get it right for these next 2 years.
And Paul, to that end, you have heard the conversation go back and forth between us and whether it's the governor's office or the Democrat leadership for the past year about, we have ideas. Okay, what are your ideas? Well, we've told you what they are. Well, put them on paper. Okay, then write them on an envelope. Then put them, I mean, it's just insane to me, the conversation that has gone on, and then we come to these things and you guys ask, well, what do you think it would be? Which is a reasonable question. But Paul, the problem is we put them on paper. We put together an entire budget. You may not like it, you may love it. But the fact that we all had our own budgets and our own budget ideas, and those conversations were not had when they were supposed to, in a responsible way, in a responsible budgeting way. I mean, if we're going to continue to do this month-to-month thing, we should just throw the whole budget process out the door and just let them operate by executive order. I mean, because that's kind of what happens here. Let's sit down and figure out where we're going and how we get there. But hurting the most vulnerable of this state, because it's the easiest cut, is not the way to go.
And abrogating our responsibility is not the way we should be doing it. We're the legislature. We should have a responsibility, and we should stand up to that responsibility.
So if you're going to advocate for a holistic approach, would you be open to at least discussions on taxes to get us through the next 2 years?
See, once again, we get back to these questions which are, as Thema says, pointed questions, but are not the discussion. We need to sit in a room. We're not going to negotiate this by saying this, that, and the other. Let's get into a room and have a holistic discussion. What I don't get in this building, unlike any other CEO sitting around, standing in front of you, the way you solve problems is you get in the room and you have conversations. In this building, we do it in silo, and then we throw bullets at each other, and we think that the public respects us. They don't. They rather see us get it right. And to get it right, we need to have conversations. And that's what we should be doing. That's what we should have done last year. That's what we should be doing now. 3 months into it, we've got 9 months left of this year, 12 months left of the next year, and we're going to limp our way? That's crazy. That's ludicrous. Nobody does it that way except up in Disneyland, Hartford. We need to get it right by getting together and having a conversation.
Can I try to follow that? We know,
Hey, Keith.
sorry.
That's right.
We know that there's a problem with the current budget, and Secretary Barnes has said that the revenue problems they're looking at on Wall Street very possibly could roll out to 17 and 18. You know from nonpartisan analysts, you've got a big hole waiting in 2000, FY18. And we also know from your past budget that you've looked at labor costs. So with those framing it, would you want to include labor in the discussion? Would it be time for the administration to talk to CBAC and say, since we need to not only balance this budget but fix a long-term problem, do you want to see talks about concessions?
Look, I mean, Keith, that, hate to use the word, but that's the elephant in the room. Because how can you not, I guess would be my answer to that question. If you are working on a budget and you have a 2-year budget and you have 45% of that budget in one area, you have to look at it. And now the governor has the opportunity to get it right when he renegotiates. Now he has that opportunity to get it right. And we certainly call on him to do so, and we call on him to include us in that. We would love to help with that process. But when you have that much of a budget in one area, you can't. I mean, it would be irresponsible to not look at it that way.
There's no silver bullet here. We got to look, there's a holistic approach we need to take. And we got to look beyond 2 years. And we got to look at all aspects, including that, but many others that we have in this building we have to look at. And that's what's important. But that's the reason why you got to get in a room and have a discussion. One-party rule just doesn't work.
Maybe we could hear from some of the hospital executives themselves
Absolutely.
about the impact of these reductions to their individual hospitals.
We volunteer, Pat.
Yes, we do.
So as Representative Claridis and Senator Fasano said, we're advocating for a process whereby the legislature can look holistically at this budget. As was said, the projections that went into the budget turned out not to be accurate. So now there's a revenue shortfall. And spending, at least in the short term, has to be cut to balance the budget. The governor has limited tools at his disposal. He has rescission authority. We believe that's a blunt instrument. We think by calling the legislature back in, we can have a more thoughtful approach. And we do believe that everything should be on the table. As was said, the rescission is $190 million in cuts to Connecticut hospitals. We imposed a provider tax in Connecticut that initially had a net benefit to the hospitals and a net benefit to the state. We were concerned about where that might lead us in the future in terms of, that was a system whereby all of the tax dollars were returned to hospitals, and that leveraged federal dollars. We were concerned by accepting a tax because someday taxes could be imposed and the dollars not returned, and that's where we find ourselves today. And now Connecticut hospitals are paying $500 million in taxes. The effective tax rate that hospitals are paying is 4 to 5 times what for-profit corporations are paying. And this is at a time where our industry is going through a radical transformation. We recognize, as responsible healthcare system executives, that healthcare in Connecticut and across the country is unaffordable. And we know that the current incentive system has driven that, which is fee-for-service. And we're moving away from that. The incentives are changing to motivate us to keep populations healthy, to focus on better primary care and prevention. We will be at risk for the health of populations in the future, which means that we have to transform the way we do business. That's going to require investment in new capabilities. And we're in the process of making those investments, and they will have a benefit to the state. 1 in 5 Connecticut residents are enrolled in Medicaid, 1 in 4 children. And then you throw in the state employees and their dependents. If we're successful in re-engineering healthcare delivery in the state to become more efficient and more effective, the state benefits. At a time where we're attempting to do that, the resources that we need to do it are being taken away. We understand that may be the only tool that the governor has at his disposal right now. But if there is a special session, hopefully the legislature will come up with a more comprehensive approach that's better public policy, that certainly protects the interest of the state, its residents, and the healthcare industry.
So, I guess what cuts are being made at Griffin Hospital to respond to these?
So again,
cuts,
since
or
the
what
tax
change?
was imposed,
I know, but I mean,
No,
what
no.
change, is it staff layoffs, is it,
Yes.
reduction in the amount of equipment you're getting, is it?
all of the above. So we've had to reduce non-salary cost, we've had to reduce labor cost, and in hospitals, approximately 60% of operating costs are labor. So you can do the math in terms of this latest round of cuts, what that might translate to, at a time when we're investing in trying to change the lifestyles of the people who live in our communities to be more responsible in terms of preventing illness, right? We're investing in new technologies to do that. So yes, all of that is at risk. Even the basic care delivery that we're providing now is at risk because of these and the cuts that preceded it. Remember, these cuts are on top of those that were imposed in the actual budget that was adopted for 2016. The cumulative effect now is $500 million.
Any other questions?
Could I ask either Mr. Malloy or Ms. Jackson, could either of you talk for a minute about sort of the planning challenge? And I don't mean how the tax necessarily has changed from 2012 to 2016, but literally like at the end of June you thought you were looking at one level of increase in the hospital tax, but you were going to get most of the increase back to now, 3 months into the fiscal year, you're getting none of the increase back. How does that affect, if at all, how facilities plan for operations in FY16?
Yeah, Jennifer, you want to take from the board's perspective?
Be happy to. It creates an incredibly difficult situation, which is why we're referring to this as a crisis, because as inherent in your question, it's such a short period of time and it's such a dramatic amount on top of, as Pat talked about, the cumulative effect. So specifically, what is going to happen is people are going to lose their jobs at a time when we dramatically need job growth in this state. The economy of the state of Connecticut will be harmed. What a lot of people don't realize is what a huge part of the economy hospitals are. We contribute $20 billion to the state's economy on an annual basis. So jobs will be lost. There will be longer wait times. Services will be cut. And most specifically, the services that I anticipate will need to be cut are those that are for the most vulnerable, who do not have resources to otherwise receive those services, even if they're not acute care hospital services. The hospitals provide a tremendous amount of health promotion and other support services out in their community. Those services will have to be cut. And as Pat talked about, the acquisition of technology and new types of medical procedures that we are all as consumers anxious to have to optimize our health and the health and recovery of those we love, those purchases will not be able to be made.
I'm John Murphy. I'm the CEO of Western Connecticut Health Network, and I'm a physician. I still see patients in the clinic a day a month, largely Medicaid patients. And I just want to give you my perspective on what the cuts really mean. The problem in running a system like ours, any of the CEOs, is these are complex environments. We operate 365 days a year, 24 hours a day. And lots of people are counting on us to be there. What Jennifer just said in terms of being in the community, offering preventive care services, Unfortunately, those are the services that we now struggle to provide because it's a financial challenge to do so. We'll be able to offer fewer of them, so access does become a problem. So what do the poor who are sick actually do? What they do is they carry the burdens of their illness quietly. They don't protest, they just don't take their meds. They run out of the meds. So take a simple example. Most of these people have hypertension, high blood pressure. So they stop taking their meds for a couple of months because they can't get an appointment, or they can't get the prescription, or they can't afford the refill. So we kid ourselves if we think we're really saving money, because what happens is their hypertension is left untreated. So they show up with a hemorrhagic stroke in their brain, and they spend a couple of weeks in the ICU, and then they go to a rehab home, maybe. Or they go into renal failure because their kidneys shut down, so they go on dialysis, which is probably the single most expensive way to provide care to these people. Or they have a heart attack and die. But you're not going to see it, you're not going to hear about it, because they carry their burdens quietly and they suffer in silence. So we're here to ask for the $200 million to be restored back to these communities. And we're asking for a conversation, because I'm not sure that these cuts were well thought out. So we would love for a conversation to take place where we can re-engage the legislators who represent these communities to think once again whether it's fair to take it out on the poor who need us most. Thank you.
Did you want that?
So I'm Dr. Stuart Marcus. I'm the CEO of St. Vincent's Health System. Those of us in healthcare, we often refer to something called the triple aim. The triple aim is to enhance patient outcomes, enhance the patient experience, and do that at a decreased cost of care. As Pat said earlier, our goal is to decrease the cost of care. Any other industry, when they're looking to increase quality and decrease cost, they make an investment first. What is happening in this state, in Connecticut, is we're cutting cost, and we're hoping that somehow quality miraculously appears. That's not going to happen. Quality is going to suffer, and it's not just the poor and the vulnerable, because when these cuts at the hospitals, when they take effect, and when a patient comes into the hospital, we don't treat the poor and vulnerable differently than the commercially insured patient. So as the staff is decreased, as the waiting times go up, and as the quality suffers, all patients suffer, not just the poor and vulnerable. And that's what these cuts mean to us. These are devastating. At St. Vincent's, this pretty much wipes out our margin, and that's the margin that we need to invest in the future of healthcare so that we can change that healthcare delivery system in the state of Connecticut. Many cities have reinvented themselves on healthcare. Cleveland, Baltimore are two examples of cities that have grown and prospered because healthcare is an economic driver. And we are destroying one of the true economic drivers in this state. Thank you.
So the boogeyman for the administration is the CEO hospital pay. Are any of the CEOs willing to give up some of their salary in order to spare some of these cuts?
Well, I'll start, and I appreciate your reference to where the conversation comes from, and that's not the conversation that's important. The conversation is patients and their families, but I'll respond to it. It is true that executives in hospitals are well compensated, and I hope so. We need to be able to attract and retain the most capable and the brightest executives to run institutions that are literally a matter of life and death 24 hours a day, every day of the year. And I find the argument not significant to the overall conversation. This state also provides tax breaks to corporations whose executives make multiples of what hospital CEOs make. So for a number of reasons, again, I'm happy to answer the questions, but that's not the conversation we should be having. The conversation is about how do we take care of the people in the state of Connecticut and how do we improve our state's economy.
Any other questions? I want to thank all the legislators for coming here today and supporting this, as well as the CEOs, and thank you all for coming.